students at Northern Kentucky University are getting hands-on medical practice without the risk of impacting patients. We visited NKU's Center for Simulation Education, which also gives local high schoolers a glimpse into the healthcare world.
So our students we're starting it right off the bat. They get simulation in their very first semester and they get it throughout the whole program. We see things that happen in the hospital and we base our simulations on that.
Our nursing program has a nursing skills lab where they learn how to do all of the nursing skills such as vital signs, putting in an IV. We have our radiology lab where the students learn how to position patients for x-rays, how to do CTs. We have our labs for cardiovascular perfusion, so those are the students who work in the OR and specifically work with patients on bypass.
The mannequins will bleed, they sweat, they cry, all different fluids. They can do any heart sounds, lung sounds. They have all pulses, so we can mimic any disease process, as well as being able to create any situation. So I'll tell the students a lot of times, while the mannequin doesn't seem real, the situation is very real.
I hate to say the word or use the word make a mistake, but it's far better to make that mistake on a mannequin than do it on a real patient.
So if the students give a medication and it's the wrong dose or the wrong medication, then the mannequins would respond just as a patient would in the hospital.
Obviously, if they're in a clinical environment such as a hospital, we can't have them practice independent at the bedside, but in simulation we can. If we're doing labor and delivery, I can't promise that someone's going to deliver while they're there. Here in simulation, we have control over that environment. We can have our mannequin deliver a baby every half hour if we need to, so we can guarantee that they'll get those experiences.
One thing that we do here in the college is we give tours to our high school students in the area. It's not just a tour, it's hands-on, so they get to see a lot of different things. They go through all of the labs in the college and get to see what they do.
And so the class that's here today is our Intro to Biomed students, and so they are getting an overall view of different healthcare careers.
I'm looking to go into pre-med because that would be like the next step in following the journey, because I want to be a neurosurgeon. I think that the lab is actually really cool because it shows like a bunch of different ways to help care for patients with shots and IVs, and I think it's like really cool that there's a whole room full of it.
I've had students that have come that I've had in class that have told me they came through as a high schooler too, and that's what got them interested in our program.
You know, everybody wants to be a doctor or a nurse. And there's so many different things you can do, even within those fields, but this is allowing them to see, you know, exercise science, radiology, lab, respiratory, and all the different things, because it's not a one-size-fits-all healthcare career.
Yes, doctors and nurses are critically important to the healthcare team. However, it is a healthcare team made up of many different specialties, and all of those specialties are very much needed for the care of the patient.
The BSN program here at NKU has 100% pass rate on the NCLEX exam, their national exam they take for licensing. Hospitals and places where our students are working are noticing that our students are very well prepared when they get out into the field or even in the clinical setting.
There is still a gigantic need for healthcare workers in the area, and so the more students we can expose to healthcare and health professions, hopefully the better off we are in the future with our healthcare workforce.
The Simulation Center opened in 2018 and is split between 2 floors. The outpatient center mimics a doctor's office, and the inpatient center simulates a hospital. Good work there.